Just a day before Liliana Martinez turned 43 years old, she received some of the worst news anyone can receive.
My brother had committed suicide on June the 27th, and he passed away on my birthday, June 28th.
During the funeral services, Liliana started to feel nauseous and began to vomit. She was taken to University Medical Center.
In the ER, when they finally checked me out and everything, they found that I had a mass in my stomach that was very large. After they did the CT scan, they found out that it was my ovarian mass. It had enlarged to about the size of a basketball, and it was putting all the pressure on my stomach and moving all my intestines over to the left side. I was diagnosed with cancer, high blood pressure, and diabetes.
Her tumor turned out to be a cancerous growth that had spread from the uterus to the ovary. So she had a relatively advanced tumor, cancer.
I cried a lot because I really wanted to have kids, and this was a final sign that I wouldn't be able to have any kids. I just didn't want to do it anymore. I wanted to give up because I was tired. I didn't want to have to go through this. I didn't want my husband to go through this because my husband wasn't working.
During this difficult time, Liliana met Maria Licon, a social worker in UMC's Infusion Center and founder of the Sobreviviendo el Cancer program. Through Sobreviviendo, Maria Licon provides financial assistance and emotional support to cancer patients with financial stress.
Sobreviviendo el Cáncer did help Miss Martinez when she was all under that Care Plus program, because she didn't have any money to cover the copays for treatment, for procedures, for medications. There was times that Miss Martinez would come, and it would be maybe a medication that was $30, $40, but she didn't have that money to buy those medications. So thanks to Sobreviviendo, she was able to get her medications to continue her treatment.
How important is it for a patient to adhere to their cancer treatment?
It's very important because the cells have a built-in cycle to them, and they will react to the chemotherapy based on the cell cycling time. So everything has to be given in a certain regimen, and if they don't adhere to that regimen, then the chemotherapy, and in her case the chemotherapy and the radiation, will not be as effective.
Sobreviviendo also helped Liliana with transportation, providing her with the Sun Metro lift service.
Another concern of Ms. Martinez, that no transportation. She has no vehicle, so she uses the regular bus for transportation. Once they're in treatment, the patients, a lot of the times, they are not able to walk long distances to the bus station. So we do link them. I help them with the application for the lift. We process that. And through Sobreviviendo el Cáncer, we're able, through the grants that we get from the foundations, we're able to purchase the lift tickets.
And ever since then, she's been my guardian angel because she has helped me so much in so many ways. I don't even know how to tell her thank you. I'm grateful to all of them there in the infusion center because they've been wonderful. My first good news was being cancer-free. Second good news was my husband got a job. We didn't give up. You know, we fought through all this turmoil in our lives, all the ups and downs, and little by little our life is looking good.
I had a rash and a purple thing on one part of my boob. I just thought it was, I had an allergic reaction to something, and I mean, because one day it's there and next day it's not. And then I decided to go and have it checked.
Deborah went to Texas Tech University's Breast Care Center, the only accredited breast care center by the National Program for Breast Centers. This means that Deborah will receive the most efficient and contemporary breast care using scientific evidence about what works best for her. After several studies, including CT scans and mammograms, Deborah was diagnosed with breast cancer.
I cried, scared, because this cancer was already stage 3. And I was scared. And I didn't have anyone. My mom just died, and it was hard, very scary. I had no one to help take care of me, no one to be here. My parents are both gone. I have no brothers and sisters. I wasn't working. I had not worked in years because of my taking care of my mom had dementia and strokes. I couldn't leave her alone, and I'm the only child. So I had no money.
Cancer in general is a difficult disease, and it's probably the most feared diagnosis among everyone. So patients who have financial challenges, of course, are facing an additional burden when they are faced with a diagnosis of cancer.
Even though they're struggling with a diagnosis of cancer, I think their main concern, if they have no insurance, is that how am I going to pay for this? I'm not going to get treatment. The doctor's not going to treat me. The hospital is going to turn me down because I have no insurance.
In 2010, UMC Foundation created a special fund specifically for targeted donations and grants for breast cancer patients. Thanks to this program, Deborah started to receive her cancer treatment.
I started chemo in July of last year. I had the mastectomy after the chemo. The chemo right at first was not good. I was very sick.
Sobreviviendo el cáncer, and that was the breast cancer program, helped her with co-pays for treatment, for procedures. She didn't have to worry about how to pay for her medical bills.
3 weeks after Deborah started her cancer treatment, she was approved to receive Medicaid.
Once we start guiding those patients, you can see the relief on their faces. You can see the hope that they get because they will get treatment. And I had a patient told me that I've never forgotten. She said, I was knocking on so many doors and nobody opened the door. But Sobreviviendo el Cáncer and UMC opened the door for me.
There is a high chance for cure nowadays from cancer, especially breast cancer. So if we treat those patients appropriately, they can go back and be a very active member in the society, and they can go on with their lives and help their families and be back to normal, or new normal, if you will. People mistakenly feel that, okay, once the treatment is finished, the last day of chemo, then the patient will go back to normal immediately the next day after, and that's not true, because many patients need a period of recovery, of both physically and mentally, and that's during that survivorship continuum, if you will, of care, they need maybe even more support and more care and more support group. So this is where the survivorship program that Mary is heading at UMC is crucial, because it helps patients through all of the phases of their recovery.
On behalf of the patients, I do thank the foundations for the support that they give our program. If it wouldn't be for the foundations, we would not be able to help all these patients. And I just want to let the foundations know that they truly make a difference in the lives of these patients that really need their help. To the people that have come every year to our Mariachi Margarita Merienda fundraising event, and for those that this is your first time, I want to thank you for your support, because this is really something that benefits our patients. And again, on behalf of our patients, I want to thank you for your support.